And after the Prophet, peace be upon him. So now we are going to look at another question. An alcoholic male patient fell asleep on the chair's arm hanging downward for 3 hours. Upon waking, he has numbness, weakness, affected hand, limited wrist movement. Means there is a wrist drop, sensory loss over the dorsum of the hand, weakness on the finger extension, loss of sensation on the wave of thumb. Which structure is likely damaged? Now this is wrist drop plus thumb sensation lost. So blood nerve supply to this area to this is radial nerve. Radial nerve is for this clinical feature vignette, and another one is a patient person fall asleep on the falls on the outstretched hand, injury of the wrist, likely damage is the superficial flexor retinaculum transverse carpal ligament. Answer is ulnar artery and ulnar nerve is involved in this. Now ulnar artery and ulnar nerve, we will be looking at the features related to this one, ulnar artery and ulnar nerve. Okay, ulnar artery and ulnar nerve. Here is the brachial artery goes downward into posterior introitious artery and common introitious artery. It gives anterior introitious artery, and then radial artery and ulnar artery is divided. In hand, there is different movement of artery. Okay, so next one is a newborn born with recurrent respiratory infection, missing physiological antibodies. That is IG. There is none of these. I think. Okay, so next one is a mother treated with toxoplasmosis first trimester give birth of the antibody will be detected in the baby's ELISA. That is IgM. IgM antibodies are detected in the ELISA. Type of hypersensitivity in good pasture syndrome is type 2 hypersensitivity in good pasture syndrome. We will be looking at the physiological aspect of the good pasture. Good pasture syndrome is autoimmune mediated damage of glomerulus and kidney, elbow, and lung involved. Now, when there is damage of, there will be cough, dyspnea, hemoptysis, glomerulonephritis, and G will be involved in this. And there is management of supportive treatment. Prednisolone, cyclophosphamide, and plasmapheresis is treatment of the choice for good pasture syndrome. So what happens? There is hemoptysis, hematuria, and other symptoms related to pulmonary and renal involvement. Pulmonary hemorrhage, hemoptysis, oliguria, proteinuria, basement membrane damage, antigen antibody damage, and all type of type 2 hypersensitivity, and then type 2 hypersensitivity leads to damage. Okay, so next one is, which of the following cause decreased lymphatic flow? Decreased lymphatic flow is because of hemorrhage or any shock condition results into decrease in lymphatic flow. Another one is in sickle cell disease. Abnormal RBCs are removed by spleen and sinusoidal capillary. Sickle cell disease, there are sickle cell RBCs. These are removed by capillaries. Next one is 30-year-old male patient present with a sore throat, cervical lymph adenopathy. CB shows atypical lymphocytes. Important diagnosis for infectious mononucleosis is monosport test. Monosport test is important for diagnostic. You can see monosport test is like this kit test. It is a rapid blood test used to detect heterophile antibody in infectious mononucleosis. So infectious mononucleosis. Okay, infectious mononucleosis signs and symptoms are fatigue, malaise, loss of appetite, headache, visual problems, tonsils will be enlarged, swollen and white patches will be there, cough, chills, enlarged abdomen and pain will be there. It occurs because of Epstein-Barr virus, and kissing disease is also known as infectious mononucleosis. As you can see, here are tonsils that are white, inflamed and patchy appearance in the tonsils. Okay, next one is a 50-year-old man underwent a hysterectomy, uterine myxoma 6 years ago, presents the lower abdominal pain, incisional hernia is there. What is most likely? Push outward from the lump. Push outward from the lump is parietal peritoneum. Now, parietal peritoneum is most likely presentation, and next one is A 24-year-old male patient presents with jaundice, pallor, breathlessness. Jaundice is recurrent because of hemolytic anemia in the patient. There are intrinsic hemolysis and extrinsic. Now, hemolytic anemia, there is hemolysis. As I mentioned, two types of hemolysis are there: intrinsic and extrinsic hemolysis. Intrinsic that occurs inside the vasculatures, extrinsic that occurs outside. Now, extrinsic hemolytic anemia occurs because of antibodies IgG or IgM. And IgG is warm, IgM is cold one. Warm antibodies are associated with penicillin, cephalosporins, or any systemic lupus erythematosus, or any CLL, chronic leukocytic leukemia. IgM involved with the cold agglutinin disease like Waldenstrom macroglobulinemia, mononucleosis, or mycoplasma pneumonia infection. Symptoms will be anemia, fatigue, pallor, dizziness, headache. Hemolysis results in the jaundice, dark tea-colored urine, back pain, kidney damage because of hemoglobinuria. So in this way, patient will have intrinsic hemolytic and extrinsic hemolytic, breathlessness, present, pallor, yellow, disappearance. So hemolytic anemia will be there. Next one is the coronary sinus arise from the left horn sinus venosus. Coronary sinus arise from left horn is sinus venosus. Left horn sinus. Next one is a newborn male exhibits unilateral cleft lip, extending at the floor, nose, maxillary, alveolar process. What embryological anomaly can be this? This is unilateral maxillary prominence with medial nasal. This is the long thing that I. Next one is a dietary management of the patient having type 1 hyperlipidemia. Type 1 hyperlipidemia patient should given low diet and simple carbohydrate with fat content below less than 20% of the total. Next one is what is the most common site of venous graft? That is great saphenous vein is that poor thing that is used for great saphenous vein for venous graft. School children had a party when they consumed fried rice. Fried rice. Here's the diagnostic point. Fried rice. Bacillus cereus is fried rice. Chinese food 6 hours after vomiting, abdominal pain, cramps, diarrhea. Organism is Bacillus cereus. Fried rice appearance. That is the diagnostic. Another one very important clinical presentation. 30-year-old patient, Hodgkin lymphoma, received chemotherapy of bleomycin and other drugs. He shows sign of pulmonary infiltrates. Pulmonary infiltrates occurs because of bleomycin. So now let me show you mnemonic for chemo. Okay, so here is the mnemonic toxicity beer, like the effects or side effects for chemotherapeutic agent. So our answer was bleomycin. As you can see, B for lungs. Bleomycin means below that is involving lung infection or any. Another one is how does low dose of aspirin prolong bleeding and inhibit platelet aggregation by blocking which pathway? That is the thrombosin A2 pathway in the platelets. Now we will be looking at the pathways of platelet. Another one is a 45-year-old male patient having retroesternal chest pain, nausea, and change in gastroesophageal junction appearance up to 3 cm on endoscopy. There is velvety esophagus appearance with columnar epithelium due to chronic GERD. Now, chronic GERD, what is? The biopsy reveals moderate differentiated adenocarcinoma. Major risk for this condition is Barrett esophagus. Barrett esophagus is a condition in which there is change in epithelium due to chronic GERD. What antithyroid anti antithyroid drugs should be administered in the pregnant woman during her fifth month? That is methimazole is given to the pregnant month pregnant woman in the fifth. Next one is a 35-year-old male patient having headache, dizziness, nausea. What is the drug of choice for this condition? Drug of choice for this condition is acetazolamide. Is given to the patient. Another one is a female patient presents a midline neck lump, hoarseness of voice, dysphagia. Calcitonin level is elevated. Stomachectomy for solitary thyroid nodule, cell balls, amyloid deposit, and cellular hyperplasia. Most likely diagnosis is medullary thyroid carcinoma. Okay, so medullary thyroid carcinoma patient will have hoarseness plus dysphagia suggest invasion or compression. Elevated calcitonin level results because of medullary thyroid carcinoma and parafollicular C cells calcitonin production. Ball cells are amyloid deposits. Cellular hyperplasia indicates early multicentric disease like multiple endocrine neoplasia type 2. Papillary carcinoma usually present with the samoma bodies often any nucleus not associated with the calcitonin or amyloid. So the answer is medullary thyroid carcinoma in the disease. Okay, which function is associated with insulin? Insulin has increased glycolysis, which is associated with insulin. Next one is what a 12-year-old boy present with the outpatient posterior cervical lymphadenopathy. Now patient cannot raise his arm above his head level and comb his hair. Combing hair is associated with spinal accessory nerve damage. Lesion in the spinal accessory nerve results into inability of combing the hair. Which immunoglobulin is involved in Rh incompatibility in erythroblast fetalis? That is IgG. Total ATP produced from one glucose molecule is 32 ATP. Next one is which of the following is aldosterone antagonist? Aldosterone antagonist is spironolactone. Aldosterone antagonist.